So today we're going to talk about a very common question that I think comes up for people. That question, do I need therapy myself? Adam, what are your first thoughts about somebody who might be thinking that for themselves and maybe putting that question to you?
Yeah, it's a question that comes up quite often. I suppose for quite a few people it isn't a question in the sense of their sense of agitation or their difficulties of mood or their social difficulties are so profound, so sharp, maybe so acute, that they're in a state of crisis and they know that they definitely need to come and seek help. So they're an easy group to make that decision for, if you like. But I think there's another group of people who just have this perhaps longer term, less acute, less urgent need, but this sense of dissatisfaction with their lives. And then it's difficult for them because when do you decide that's bad enough to come? So I think that's quite a difficult question. What do you say to people when they ring you and they say that? They sort of say, I'm not myself at the moment. Do you think I should come and see you? What do you say to them, Jim?
I suppose I try to understand more about just how much it might be affecting their lives. Whether that quality of life is reduced to the point that it is bad enough. I'd try to get a sense of why now as well, which I think it can be useful. Because often people might have been struggling with the problem for a while. At times it's been pretty bad, at times it's been better. And something in particular often motivates or triggers that phone call. And it can be quite useful to understand what that is in determining whether now is the right time.
Yeah, so you're introducing the idea of a window of opportunity, that people may, in a sense, need therapy over a longish period, but there may only be certain times when they're going to benefit from it. They may be so entrenched in old behaviours, or there may be life circumstances which mean that they're not going to engage at a particular time, and at other times they're able to engage and make changes. Yeah, I think that's true. What about how would you decide which therapy or therapist to go to? Do you have a sense of what you say to people when they say, why should I come to you?
Yeah, I mean that's quite difficult I think if you're looking for a therapist, because there's so much choice. And you might not know kind of which type of therapy, like you say, is going to be right for you. It's not an easy one to sort of answer categorically, I think.
And of course it's up to the person. At the end of the day, the client has to make their own mind up, don't they?
Yeah.
You can tell them what you offer, but they have to decide for themselves whether that's what they want. Yeah,
and I guess therapists have a shop window in terms of a website often, and that can help a client think about whether this might be somebody that they want to work with, whether what they're saying kind of makes sense to them. And I guess finding a therapy or a therapist is about trying to find a fit in that way. And if you're really unsure still, after having kind of maybe read something about somebody and the way that they work, or had a conversation with them on the phone, is that you might want to set up some appointments with a few different therapists, maybe 2 or 3, and get a sense of what you think it might be like working with that particular person, or working in the particular way that they work, just seeing if that fits with maybe how you see the world.
Yes, and we tend to place a lot of emphasis upon the particular modality, the type of therapy we each offer. But it matters a lot whether or not you get on, doesn't it? All the research says that you need a good therapeutic alliance, and you can't tell whether or not you're going to develop one of those unless you try it, really. You can go on the basis of personal recommendation. I always think that's a good thing to go on. If a friend has been to see somebody and they say they're good, then that's a good starting point. But you really need to go along and just see if you click, if you feel that this is somebody you can trust, because you're not going to expose yourself and talk about stuff that matters if you don't have a feeling that this person is going to be respectful and helpful to you, that they're somebody that's trustworthy. So the quality of relationship seems really one of the key things to make a decision on whether this is somebody I can get on with. Never mind what they're offering, do I feel I trust them? Do they have integrity?
And as it's a service really, isn't it, that you're buying when you come for therapy, and so it's about your relationship that you're having with somebody else, that makes it ever more important.
Absolutely. What about the, just thinking we should talk a little bit about the other end of the arrangement, how we know when, as clients, how the client will know when they're finished, and how you avoid what Freud called therapy terminal and interminable. How do you know when it's over?
So what do you do in that regard?
Well, as the practitioner, I feel I know, because hopefully if I've done my work properly, we've set targets at the beginning of the therapy, and therefore if you've reached your goals, it's time to finish. But what you find, of course, is that clients vary a lot. Some people they sort of have a sense that they've had a very good experience, they've achieved a lot, and there's a feeling sometimes, I think, of wanting to stay a bit longer. And sometimes that's a legitimate feeling of, well, actually I've met some of my goals, but there's these other goals that I'd now like to focus on. But sometimes I think as the therapist, you have to make a bit of a judgment call and say, well, I don't think it's ethical for us to keep on working. I think I've become in danger of becoming somebody that you just enjoy talking with. And I usually enjoy talking with my clients, but that's not a good enough reason to meet. So you have to feel that there's some, I think both therapists and client need to feel there's some meat, there's some work to be done here. Purpose to the meetings other than just social contact. Although I'm not averse to having a conversation briefly at the beginning and end about holidays or decent restaurants in the area. But I think the session itself needs to be business-like and be going somewhere.
Yeah, and I suppose one of the things I tend to say is that therapy needs to be about wanting to change something.
Yeah.
And if you can't identify something in that way, then it doesn't really make therapy possible.
Yeah.
I think.
Yeah, I think that's good. And I think you had a very good phrase that when we were talking about doing this video. You came up with a very good phrase that you'd borrowed, I think, was it from solution-focused therapy?
From motivational interviewing.
Motivational interviewing.
Is this phrase about being ready, willing and able. And I think what that phrase describes is, if we're thinking about readiness, is, have I got the space in my life at the moment to be able to commit to therapy and do the work that might be involved in that. So it's about kind of priorities and how busy maybe things are for you.
So it's about commitment.
Yeah. The willingness is, I guess, kind of about importance. Is that if you have some vision that therapy could help in some way, if you think that it's possible that it could improve things for you, then it's going to feel kind of that it could have some level of importance to it, and that might make you more kind of willing to enter into it. If you can't see any possibility that it's going to do anything for you, then I think you might be very unlikely to pursue it. I know we go into therapy not knowing that for sure, and there's no predictability to it. So I guess it's, am I willing enough, or does it feel like it was important enough to give it a go and have some faith kind of in trying it out and the process of it.
Yeah.
And then the able then is about kind of confidence really, is do I know how to do this? But I think that kind of aspect is really sort of addressed in the therapy itself, because that's what a therapist is tasked with doing, is helping you think about how you're going to overcome this.
Giving you the tools or helping you develop a tool.
Yeah.
Yes. And I guess that's going to take a different amount of time for different clients as well, the able, because we talk about whether or not people are suitable clients for short-term therapy, short-term cognitive behavioural therapy, and I think there are some people who are not clients for short-term work, but I think I'd be quite reluctant to say that people are not clients for cognitive behavioural therapy at all, because I think if people want to pursue therapy, you can probably help people to become more able to engage in therapy. It just may take a bit longer, But I can't off the top of my head think of any group that I would say shouldn't ever seek cognitive behavioural therapy, or for whom it's not appropriate in any way at all. Do you think that's right, that there's nobody that we would say should never approach the possibility of coming for therapy?
I would say in some ways yes. I think that CBT has to offer is that it's about learning skills and strategies
And everybody can learn.
to cope better.
Yeah.
And everybody can learn and get something out of that. So I guess in terms of specifically why you might not come for CBT or need CBT, then I'd be agreeing with you. In terms of some people that might not need therapy as a general thing, I suppose I'm thinking about whether people are having normal emotional reactions or responses to a particular life event. So I'm thinking about the recent loss of a loved one, or a separation in a relationship that's been particularly.
Yeah, you're saying something very important there, I think, because you're saying something about that it's very important for us as therapists and as clients to recognise that life is hard and sometimes we feel horrible, and there's nothing in a sense wrong with that.
Yeah.
That's the way it is sometimes.
Yeah.
And I think, as the Americans say, you have to suck it up sometimes. And you shouldn't think there's something wrong with you because you're not feeling great.
No.
Under all circumstances. If a lot of bad things happen, you're going to feel bad, and that's okay. It just depends how long it takes for you to stabilise again. That's the issue, and whether you bounce back, doesn't it?
Yeah.
That's the key issue.
And I would never suggest to anyone, don't phone if you think that's the case, because sometimes just a conversation or just meeting a therapist once can actually be really helpful and therapeutic in that regard, as people just get a bit of assurance that actually what they're experiencing is a normal reaction to what's just happened to them.
Yeah, and I think we're quite good in CBT about using that idea of normal. I think we're quite comfortable with saying you don't have to be normal, and there's no requirement to be normal, but it's useful to know statistically what normal is and to see how much you're deviating from that and get some sense of whether or not you should worry about yourself. And there's no problem at all about people coming for a single session to have an assessment to see if they're okay in themselves, and we can then run a few questionnaires and ask a few key questions, and we give people a sense of, well, yes, I think you're doing okay, or you'd expect to feel like this if you've had these circumstances, or well, maybe it would be worth your while coming and committing to a few sessions of therapy. Okay, well, that was a good discussion. Thank you, Jim. And I hope we've helped you to have a think through the issues about whether or not coming along for cognitive behavioural therapy might be useful for you, or if you're in CBT at the moment, thinking about whether or not you're at the right place in your therapy and how long that therapy should last.